Your chap there doesn't want me wandering all over the place, I don't think.
I can follow you.
There's a mouse on that.
Let's move to. Well, it's a pleasure to be here. Except for those people racing around last night making all the bloody noise. What someone's doing at 5:30 in the morning racing their car, I don't know.
They're on our headaches.
They've got something wrong with their heads, that's all. Someone, I was asked to specifically welcome Jane Salters to the meeting, is that right? Did I get that right?
Hello, Jane.
Hi.
Thank you for coming along. What I'm going to do is say a few things about the disorder, a little bit about where the research is at the moment, and take questions. It's a small group, so you could stop me, I think, any time that you like. It probably doesn't make much difference to the web streaming business. You should know that we're online, so probably if you wanted to say anything horrible about anybody, that wouldn't be a very good idea. Because it'll go, after 4 seconds, it'll go out to the entire world. Although it won't be on YouTube. Unfortunately, the YouTube version is going to be edited down, so anything crazy we say will be taken away from it. It's always considerable privilege for me to talk at meetings about cluster headache. You thank me for what I do. I don't think you've probably got no idea about how important the problem is from my perspective, because it gives physicians the opportunity to do something, neurologists in particular, who haven't been very good at dealing with headache, a unique opportunity to do something that's really substantially good. So I think that as a group, cluster headache do more for us than we do for you. Actually, much more. Look at it from a global perspective, and we can do a lot more. I was asked last night what you could do for me. I don't know what to do. What thing that mostly an ouch group and all cluster headache people could do would be to get together and beat the political classes into understanding, Congress people, that it's totally unacceptable that there's no money spent on your disorder on research in the entire world. That's quite a big thing to say. So political action and organisation to make our Congress representatives understand that you're a substantial group of people with an important problem that's being ignored. That's what you should do if you want to grab yourselves to do one thing. That said, so most of you will know everything I've got to say except one or two things which are new slides which I just made yesterday you couldn't possibly have seen. So for the very hard-nosed people, if you think there's nothing said, or if you're listening out there in internet land, if you could get your coffee for a little while, but you ought to keep your ear tuned because towards the end there'll be something you couldn't possibly have heard. That's a bit cruel. That's the way you keep an audience, be really cruel. Several years ago, we put cluster headache together into this group of conditions called trigeminal autonomic cephalalgias, which just talks about the idea that there are groups of headaches where some of the symptomatology that you know very well and recognise very well are very prominent. The eye watering and redness and nasal congestion, and drooping and swelling around the eye. That type of symptomatology are called cranial autonomic symptoms. Cranial because of the head, autonomic because of the nerve that mediates them, which is relatively well known now. It's quite interesting to think that maybe 30 years ago, almost everything I'm going to say wasn't known. I think that's quite extraordinary. That it's a relatively short period of time in which there's been quite quantum change in the understanding of the condition. These other conditions are much rarer. Paroxysmal hemicrania is your indomethacin sensitive cousin. Hopefully you could have them in your tent because they're probably about 1,000 times less common than cluster or something in that sort of order. So that's pretty rare, and that they would otherwise manifest very similarly. I talk about differences if you wanted to. And there's this other condition, SUNT, or SUNA, which is an acronym for patients with very short-lasting attacks that have very, very prominent features like eye watering and so forth, what I call granular autonomic. And we put them all together in this one umbrella term for what I'm illustrating here is something called the International Classification of Headache Disorders. This is the second edition. It's being revised at the moment. It's the sort of Bible that, if that be a good term, that medical people use to classify headache problems. World Health Organisation's just picked this up entirely and taken it to its bosom and uses it for its classification. It's difficult to see down the bottom there. There's a condition called hemicrania continuous. It's deliberately in grey because at the moment it's not considered one of these syndromes, and the classification committee and the various subcommittees, or one in particular, this what's called Section 3 subcommittee that I head, is obsessing, and that's the word, over whether hemicrania continuous should be part of this classification. You probably think that it's a bit weird that we would sit around obsessing about this sort of thing, but it's the kind of thing that people like myself and my colleagues that are interested in this area will spend days obsessing over, because that's the kind of people that we are, obsessing over stuff like that. Last time I was at this meeting and at other cluster meetings, I had this discussion, and I'm happy to have it. I'm interested to have it again today. People might have thought about it a little bit more, or have any views that you have. At the moment, this classification is being revised, and then probably the third edition of this system will come out in maybe 2014. It's a slow process. And one of the things one of the terms that's used in classification is this term episodic or chronic. You'd be very familiar with it in your context, what chronic cluster headache implies. It's a horrible problem, of course, and it implies that it happens more or less all the time. The committee is thinking about whether it should change the term from episodic and chronic to remitting and unremitting, because committees like to think about stuff like that. I don't know if anyone's got a view. Some people, last time I was here, expressed a view not to do that, and I hadn't thought about that perspective before you said it. It's quite salutary for me. It stopped me in my tracks. If anyone's got a view, or anyone or any cluster person on the internet who's listening has a strong view, they could email you rather than me. Maybe DJ will provide an email afterwards, but I'm not sure I want to get all the emails, but interested. Well, actually, I wouldn't mind getting them at once, but because it'd be interesting to know what people thought about it. I take the view that because you have to live with the terminology, I don't. If you had a strong view, the committee would be very happy to hear it. And if everyone in cluster world thought that chronic was a dumb idea, you should say that. Well, I know you think cluster's a dumb idea. I don't think I can change that just at the moment. But
what would the quantified definition of remitting versus unremitting be?
yeah, well, at the moment, that's the next question. At the moment, we use having a break for a month. I actually think that's not enough, personally, but I don't have the problem, so I don't feel I should be the person who says that. But again, if you had a view about that, if you thought that you needed 2 months, for example, that a longer period of break would be better, I don't know. Last time I was here, some people expressed the view that the word chronic had an implication of severity that you wanted to keep. It's fine. We'll keep it. But if you didn't like it, certainly entertain changing it. The main committee takes fairly good notice of what this subcommittee does, because because the problem's well defined. It's clear in the main committee that to everyone involved in it, that cluster patients are very well motivated, and the organisations seem organised to the medical